So here's the heart here. So the heart's 4 chambers. So we've got the right atrium and right ventricle that pumps blood to the lungs, and we've got the left atrium and left ventricle that pumps blood to the body. So this guy's 2 most important or severe congenital defects are a stenosis and the pulmonic valve right there. So that valve was formed abnormally from birth, and it's basically tight, and so it's hard to get blood out of the right side of the heart, so the right side of the heart's become thick. So that's one of his problems. His other, and probably the most pressing problem, is he has an abnormal blood vessel connecting his aorta and his main pulmonary artery right there. So it's called a ductus arteriosus, and it's something that allows blood flow to be shunted around our lungs. Basically, we don't use our lungs very much when we're in utero, so it shunts blood around the lungs. And what happens is if that blood vessel doesn't close after birth, normally it does, then it causes a lot of extra blood to go into the lungs, and it can lead animals to go into congestive heart failure. In fact, I think it's about 80% of these dogs, somewhere between 70 and 80%, don't make it past their 2nd birthday if this defect isn't fixed. And so both of these things we can fix. I do think there's some minor abnormalities in a couple of his other heart valves as well. I think his mitral valve is a little bit abnormal, and his tricuspid valve is a little bit abnormal. So they're called dysplastic, but I don't think those are going to be a major issue. So basically the 2 things that he needs done would be basically to occlude that blood vessel, the ductus arteriosus, so that's the 2nd defect we talked about. And you can do that either surgically by doing a quick surgery to open up the chest and tying it off. And most of those dogs, independent of other heart disease, will do totally fine with that. And there's minimally invasive procedures, which we tend to recommend, where you go with a blood vessel in the groin, and you can put a device inside the blood vessel to seal it off that way. So you can either do a coil that causes a big blood clot to happen in there, and then you get tissue that grows in there and closes it off. Or there's a couple different devices that we can put in to plug it up. And I'd rather put a device up there if we could, because that causes a real good seal in there. The other thing we need to do is for the pulmonic valve, or the stenosis, is we need to open that up. And again, you can do something surgically, or you can do something minimally invasively. And we definitely recommend a minimally invasive procedures for that. And that one, you go through a blood vessel in the neck, the jugular vein, and you introduce a small balloon down into the heart. So down into the right atrium, into the right ventricle, and right there, and then you blow the balloon up, open that thing up. You basically tear that valve open a little bit, and then we measure pressures afterwards, and we do this only after doing an angiogram, so we can do some measurements. And most of those guys, you can reduce the pressure gradient across there significantly by introducing the balloon in there. And we don't leave the balloon in there. That's one question I always get. You leave it there. And so you just deflate the balloon afterwards and measure pressures in the heart to make sure that you did a good job. I'd say, if we're talking about both procedures independently, usually the prognosis is for the PDA. If the procedure is done well and goes without complications, they have actually a very good to excellent long-term prognosis. Pulmonic stenosis probably isn't quite as good, but still a lot of them can live a normal life after getting a balloon valvuloplasty. Now with the 2 together, that's where it gets a little bit tricky, just because the prognosis is probably not quite as good. So I would put his prognosis as guarded in the long term. But a lot of it depends on how he does with the surgery. So there certainly are some complications that can happen with the surgery. Obviously, the big complication that we don't want to happen is it's always possible you cannot make it through the surgery. So doing both of those, there are risks for heart rhythm disturbances. When you put a device in the heart, there's risk for the device to move around or to embolize to blood vessels. There's risks of hemorrhage, unfortunately even fatal hemorrhage. But most of the time they do well with these procedures. So there's certainly something that we do with some regularity in cardiology.
Right.
So,
Well, what choices would we have? I mean, what would happen if he just continued on as he was?
probably what's going to happen, so one of two things. Either disease can get worse. Most likely what's going to affect him would be the patent ductus arteriosus. So it causes, again, all this extra blood flow to go to his lungs, and eventually, likely what's going to happen is that he's going to get congestive heart failure, or get fluid buildup in his lungs. Then he's going to require medications to keep his lungs dry. As far as how long they live after congestive heart failure, if they can't fix the defect, they can live for several months to over a year with that, but certainly it's not much of a, obviously much better to do the surgery to fix it. With the pulmonic stenosis, he can be at risk for getting fluid buildup in the abdomen. It can be at risk for exercise intolerance and fainting, and for both of these, unfortunately, he can be at risk for sudden death. So,
right.
I think he's certainly that there's going to be a risk with the surgery, but I wouldn't be recommending it if it wasn't the right thing to do in his situation.